Only in America.
Only in America.
Only in America.
Only in America.
Only America.
Only in America.
This week, what we're talking about is the pandemic recovery and what it looks like in the most diverse town in Iowa.
We are a very unique and united community. A lot of people think that we are just a town full of all these different people with all these different issues and challenges. But I think Storm Lake has been able to work together to be united in many different things.
From the National Immigration Forum, I'm Ali Nirani, and this is Only in America. You know, with vaccination efforts across the country showing steady progress, there is a collective feeling of cautious hope and relief poking its way across the United States. But, as we've discussed on previous episodes of Only in America, barriers to access and trust have complicated the rollout for immigrant populations. So ensuring safe, equitable vaccination campaigns is a challenge for communities across the country. But look, the rollout for an immigrant in New York City can look quite different than it does for one in small-town Iowa. In small but diverse communities, how do local leaders educate and support their residents? What can they do to establish trust with those who are too often left out of the discussion? As we've said before, we're only as safe as our most vulnerable community members. Recovering from the pandemic will require small towns and major cities alike to invest in education and equitable access for their immigrant communities. And in the longer term, promoting leadership that's more representative of the community at large. So, what does this look like in practice? Today, we're taking a trip to one of my favorite places, small-town Iowa, to find out.
Support for the National Immigration Forum comes from the Carnegie Corporation of New York, supporting innovations in education, democratic engagement, and strengthening international peace and security. And from Humanity United. When humanity is united, we can bring a powerful force for human dignity.
My guest this week is Maria Ramos. Maria is a city council member in Storm Lake, Iowa. A significant share of Storm Lake's approximately 11,000 residents are immigrants, many of whom work at the town's Tyson meatpacking plants. Storm Lake has one of the most diverse populations in Iowa, and it's gained national attention for the ways its immigrant community have kept it thriving, while other towns in the state have suffered from population decline. And while immigration has clearly been a success story for Storm Lake, the diversity in language, culture, and lived experience creates unique challenges for a small town pandemic response. As a first-generation immigrant and city leader, Maria has seen firsthand how the community has struggled and how it has come together to support one another. We spoke about Storm Lake's pandemic response, how she's working to educate her constituents, and what she wants to see from community leaders. First of all, Maria, thank you so much for joining. I really appreciate this. Thank you.
You're welcome. Thank you for having me.
Tell me about Storm Lake, Iowa, where you live and where you are a city councilor. But even before that, tell me how you got to Storm Lake.
Storm Lake, Iowa is a very small rural community. You know, it has grown a lot in the past few years. We think we're about 14,000 in population, but we won't know until the census comes out, right? So I believe the last census was about 10,000, but we are way past that. I came to Storm Lake in 1991, and how did I get here? The meatpacking plant, I will say. Friends of family were basically invited to come and work here at the Tyson, which was IBP at that time. And we've been here since then. My husband continues to work for what is Tyson now in the turkey plant. and I am working at a community health center as a human resources manager for the last 12 years next month.
And so a couple of years ago, you decided to run for office. Tell me what led to that decision to run for city council.
I've been involved in the community in many different ways, volunteering in different organizations. And one of them is Salud, which is a multicultural health coalition. And I will say that my leadership skills were known through that organization, I will say. One time I said that Salud was kind of like I was a child of Salud, per se, because Salud is all about empowering, encouraging connections with community members and collaboration. And one of the things that we really focus on is empowering leaders, local leaders, to hold positions within the city. And that's how I came about. I was pushed, encouraged, empowered, I will say. So I decided to run for city council because I just felt that I could do more than what I was doing. And I have never had an agenda with the city per se, but more than anything, my goal has always been to serve my community and more than anything, to empower others to do so as well, and to empower others to participate in the decision making of those things that impact everyone. So just trying to make them understand the importance of that, and that's why I decided to run.
So you decided to run, you're in office, and then just about a year ago, or a little less than a year ago, as you're representing and serving the community, COVID-19 hits. Mm-hmm. Go back to when you first realized that this was going to be serious. What was going through your mind?
I think that obviously, I had many different plans, many different ideas when I started in city council and how to get community involvement in the many different things. And then, we started hearing about COVID, and it didn't really hit me until obviously I started to see the numbers increasing here in the community. And when I really thought, oh my God, it is really a serious thing, and it's when Tyson started to get impacted, and also because we know that most of our immigrants and everyone that comes here from another state usually are to work at Tyson, and knowing how confined they work and how close they work with each other, it was so scary to know how that was going to impact everyone and their families.
So what was done kind of in those early days to help the community understand that this is what the risk is?
A lot of community members, along with local health centers and even the city, was highly encouraging everyone to social distance, wear their mask, and communication with Tyson to ensure that they were doing everything they could to protect their employees was also a part of it. And I think that has helped a lot.
Yeah, how do you think that this was different in a small town of 14,000 people like Storm Lake? Were there challenges that you think were unique to Storm Lake when the pandemic hit?
Not so much, I will say, a challenge. It's always a challenge anywhere, but I think here with a small community, everybody knows each other. If you are part of a coalition or volunteering somewhere, someone that is either managing, working, or at Tyson or in other places in the community. So that's the good thing about that you can always have that partnership, the communication, that discussion in regards to what are we going to do to ensure the protection of our community members, and what are we going to do to come together to make sure that the safety of everyone in the community. The challenge has always been language barriers. We are such a small community, but we're so diverse, and we have so many languages here that it is so hard to have the educational materials in all the languages. It's also really hard to communicate to certain individuals in regards to whatever it is that we're trying to convey or communicate with them. So that has always been a challenge for not just COVID, but for many educational opportunities in general for our community.
What do you think your role as a city councilor, not just only as a city councilor, but as a community leader and Latina? People could say, okay, I know Maria because she not because I know her friends or her family, but she's one of us. How did that help?
I think it helps a lot. I mean, it is, obviously a big responsibility to feel that you are not so much that you're representing a certain group, but that people think that they can count on you for many different things. So it's definitely, a weight on my shoulders to always think that. So I always feel that I need to take a step further of whatever it is, either to educate or just come forward and come up with an idea and share it with someone that will benefit my community in general. In regards to COVID, as soon as I had my shot, my COVID shot, I automatically posted on Facebook and, talked to people that I know. And soon after that, I started getting messages. I started getting calls. How do you feel? What do you think about it? All those things. And I think that that's my goal. My goal is to start a conversation, and not that I know everything, but encourage, and try to convey that information that I know, or refer them to someone that knows that information. But at the end of the day, my goal is to put it out there and start a conversation. And like I always say, just plant that seed so something can grow from there.
As we're starting to talk about the vaccine and hopefully it moves across the country, what are the questions that people are coming to you with?
There is so many questions. What are some of the side effects after you get it? How did you feel? I'm hearing this and I'm hearing that. I'm hearing from social media, I'm hearing from TV that this could happen. What if I decide to go ahead and maybe you didn't have a reaction, but what if I do? Some of the other concern has been, well, I'm a caretaker, I'm a caregiver for my spouse or my child that is sick. What if I end up having a bad reaction and end up being in the hospital sick for a few days? Who's going to take care of the person that I'm caring for? Some of the other concerns have been, what if I get sicker than if I would have gotten COVID? And those are a lot of the things that I feel that we need more education on, because obviously I started a conversation, but a lot of times I can't end it because I don't even know the answers. And I think that a lot of people don't know the answers, and to say, no, you're not going to get a reaction, it's okay, it's safe. I can't do that. So, my ultimate goal is to encourage and let them know what my experience is, and hoping that will help them make the best decision for them.
And are there questions that come from the community around immigration status? Are people afraid because of their status?
Yeah, there has been actually a couple that have said, well, is it free? And what kind of information is going to be collected? It just reminded me of when I was, helping with the census in the Complete Count Committee. It was the same questions. What kind of information is going to be collected? It's coming from the government. So is my information going to be given out as someone that has received the COVID, and how is that going to be used? So there is quite a bit of that fear still, just like it was when I was asking them to give me their information for census. So
they probably look at you and say, oh no, here comes the counselor. Yeah. She's got all kinds of questions. What about other leaders kind of within the city? Like what's the role of the mayor or the police chief and others in terms of helping people feel comfortable getting the vaccine, or even just learning about the vaccine?
I think we are taking all the same type of role. We are very limited on what we can do in regards to, obviously, like the allocation of the number of vaccines that are coming through. And most of it is through public health and in the state and all of that. But in regards to local efforts, the local hospital, the police department, the sheriff, they're all posting on social media when their employees get their immunization, and then they kind of give a little encouragement on their posts and stuff like that. So that's pretty much what we're doing right now. We're not really taking on a big responsibility to say we're going to target this many. We're going to, we don't really have a specific plan other than and try our best to just encourage the general community.
Do you feel like the community has been brought closer together or kind of pushed apart by COVID?
I think it has come together because all those that were affected or are still getting family members getting sick and all that, the community, especially the Latino community, they have come so close to figuring out who's sick, to how we can help them, have a fundraiser event. And a lot of those fundraiser events, they have become very clever in regards to how they will do those. They are doing raffles through Facebook. They're doing just different fundraisers and to identify. They don't really identify the person that they're helping, but just in general to help someone in need. And so among the community, they identify who has a sick person, and they help them that way. So I think that it actually has, community members have come closer.
And what's the role of the churches in the community getting through all of this?
They are trying to do a lot of same thing, getting information out there in general terms that I know of. They don't really have a specific role or obviously I haven't talked to them, so I'm not really sure what their plan is. But what I have seen is also they have also done a lot of social media events and things like that.
For people who don't live in small town Iowa, what do you think our biggest misconception is? What don't we understand about Storm Lake?
I think that a lot of the things that they don't understand is that we are a very unique and united community. A lot of people think that we are just a town full of all these different people with all these different issues and challenges, and that we are just have more problems than solutions and things like that. But I think is the other way. I think Storm Lake has been able to work together, to be united in many different things. You have seen, I don't know if you have seen or noticed that we have many like food banks, food distributions, and the community comes together to volunteer for those, without having to sign a paper saying I'm going to help you every week or every month. They just show up and they just come together, and I think that's a good representation of what our community is. And you will go see these food distributions. You will see young, medium age, older, all different. I call it a very colorful event because you that's how Storm Lake is. It's a very colorful city, and I love it.
Mm-hmm. Yeah. So I mean, you see the pictures of people needing food assistance. It's so tragic. Is the need growing in Storm Lake?
I wouldn't say that it's growing. I think that, definitely the need is there. I think that we are trying to focus on having them be sustainable versus, and just trying to see what the need is and try to help that way with a plan that one day that family is going to help another family. So, I think that we're moving to that direction, and I think that we're going to get there.
So let's say, we're having this conversation in 2 years. Where do you think Storm Lake is in 2 years?
I can only hope. I hope that Storm Lake will be a city that will be a representation, which I think we are, of what every other city should be, that we see the representation on who we are as a community in many different levels and in many different ways. Obviously, the school board already showing some of that. City council is already showing some of that. But I want to see more. I want to see the different representation of the all the little communities that we have within our city in different places, serving in different places within, whether if it's our city or whether it's our schools. I would like to see more doctors. I would like to see other than just a Tyson. I want to be able to see everyone represent who we really are in many different places, and have the resources also with the representation of our community, an area where we can help everyone within our community in a place where everyone can go and feel welcome and feel that the resources are there for them regardless of who you are.
Yeah, so I was just going to actually ask for a little bit more about Salud, because I remember when I was there last year, I met with a lot of the folks who were part of Salud. Tell me a little bit more about what's the organization doing kind of at this moment, but then also, again, kind of moving forward. It feels like it's such an important part of the fabric there.
I think it's an important part of Storm Lake. I think that we were blessed when we founded this organization, and we are currently going through a restructuring change. We recently became a non-for-profit organization. We're currently going through a whole strategic planning on what Salud was and what Salud is going to be in the future. We are hoping not to change much because Salud has been so organic in the past and it has worked very well. But I think that just moving forward is going to be, for say, more official in many different ways. And so we're revamping a lot of things that the Facebook page, the website, and just in general, the way we collaborate with the community and what our goals will be for the next few years. And some of those are, bringing and promoting leadership within our community. So I think that's going to be huge, and however that may look like, but I'm hopeful about it.
So one of the things I meant to ask you about was, when I've been there going through, Main Street and the downtown area there, just the number of Latino businesses that have kind of really become a part of the community. How are those businesses, how are not just the Latino businesses, but just the business district itself? How is that doing in the context, of COVID?
I think there is obviously a few that are really struggling. In general, the Latino stores or, Mexican stores, I call them. I think that as long as Tyson is running, they're going to be doing great. I think that that's the place where we get our stuff. And as long as we continue getting a paycheck, that's what we're going to go get our stuff. So, our groceries, I remember when I first came to Storm Lake, I had to drive all the way to Omaha or Sioux City to get just simple things. And now I can, just drive a couple blocks and, or even walk in the summer and get my stuff.
But you're right. We should have talked about this earlier. But I mean, Storm Lake is a factory town. Tyson
has a big role in the community.
Yeah. So what gives you hope?
The new president gives me hope. The new administration gives me hope. Just in general, I am just a very hopeful person, but I will say the new administration gives me hope.
Last question for you. The name of the podcast is Only in America. So just to finish this sentence, Only in America, ...
Only in America, well, an immigrant that came to Storm Lake, Iowa from California gets to be on a podcast with you.
I'm going to go on the record and say this is not the highlight of your...
Oh my God.
Well, see, nobody's ever given me that answer. Everybody, you're making me blush. Well, thank you very, very much. And I should also thank you very much for the pozole recipe. Last time we were hanging out,
Yes.
taught me how to make pozole.
Mm-hmm.
So I've done it once or twice since then.
Yeah, you definitely need to come back to Storm Lake and then we can cook something else.
Sounds very good. Thank you. Maria Ramos is a city council member and good friend in Storm Lake, Iowa. You can learn more about Maria at our website, immigrationforum.org/podcast. And if you like what you hear, subscribe to Only in America, wherever you are listening to this episode. Only in America is produced and edited by Katie Lutz, Joanna Taylor, and Becca Wall. Our artwork and graphics are designed by Carla Leja. I'm Ali Nirani. We're going to be taking a break the next few weeks, but stay tuned for our next Only in America series this spring. In the meantime, hope your month is safe and healthy.